So this is going to be like really casual, and I'm not going to take too much of your time this morning. Um, if you just start out by stating your name and spelling it for me.
Perfect. Kaitlyn Jones, Kaitlyn Jones.
Okay. Tell me where you're at, and just a little bit about COVID in your community.
Sure. So I'm in Delta County. I work for Delta County Memorial Hospital Foundation. So we've done a lot of community outreach during COVID, basically so that hospital staff can keep actually fighting the fight and making policy adjustments to keep staff and patients and everyone safe. So we've done a lot of community outreach with people, trying to get sewn gowns and masks and basically every homemade PPE piece of equipment you can imagine.
How many cases have there been? What's going on like that in your area?
So I think we're up to 44 cases. Delta County has kind of been slower to have an uptick, I guess you could say. The last 3 days, I think we've gotten more cases than we did the first 3 weeks alone.
Mm-hmm.
So we're still kind of growing in cases, but a lot of them are recovered, which is great news. Because a lot of people in our valley work outside of the county, it's kind of some interesting dynamics there with people traveling to Gunnison County and Montrose counties. That's where they work and it's essential, but where they get reported and how all that goes down is a little bit different.
Oh, I see. Do you know, so tell me what your job title is and what you would normally be doing if this time last year, maybe.
So I'm the executive director for the foundation. In a normal operating world, I would be gearing up for our fundraiser that comes this fall, which is kind of happening, but planning things is very tentative right now. And then developing programs in the hospital and just working more towards meeting needs and demands of the hospital.
Mm-hmm.
Instead, I get to not do those things, or at least less of those things.
Mm-hmm. How has your role shifted because of COVID? What are the things that you're doing now in place of your normal routines?
So a lot of it is at least consistent in that I'm working with the community a lot. That was kind of always been my role, but directing people on how to properly sew things is definitely not what I expected to be doing, or finding the correct mask pattern or gown pattern and running around the hospital finding someone who is average size, because I'm 5 foot, so nothing that fits me fits normal people, to try on said equipment to make sure it actually fits and works for the people who will be using it.
I gotcha. Georgia said you've got a group of volunteers helping you out. Are these people that normally volunteer for the foundation, or have you had to recruit volunteers to help with this PPE program?
So I am working with volunteers. Recruit is probably not the right word for Delta County. It was more like direct a massive effort that was already trying to happen on a natural scale. That I keep track of. We have over 100 people who have contributed in some way. Directly for masks and gowns, I think I have at least 50 individuals, and those are just the people who say, hey, I brought this in. That's not including I don't even know how many numbers, to be totally honest, that just drop off masks and say, oh, here, and never tell me their name or how much they've actually done. So it's been an insane amount of people just coming forward. And some of them are like longtime hospital or foundation supporters, but a lot of them just want to help. So
Hmm.
it's been really cool to see the community rally like it has.
That's awesome. Um, how's your hospital doing? How's the
You know,
morale of the people in the hospital working there every day?
I know there's some struggles for sure. There's a lot of changes that just on a daily basis as far as what we need to be doing and what's best practice. So I know that's hard on a lot of people to be in a constant state of change, in addition to having this new threat that anybody could be carrying. So there's definitely some morale struggles on that. Um, we've really tried to emphasize that we should reach out for help. We've had a lot of employees that have actually also been helping to make some of this personal protective equipment, which I think in some ways gives people a sense of control to what's happening. Um, we actually just did a fun like Broncos mask and clothing day yesterday just to kind of help normalize a day and to give people something fun and an outlet that just doesn't have a strict COVID response behind it.
Hmm. Can you speak to how your communities come together? What organizations have stepped forward or brought volunteers or provided funding or supplies or connections?
Yeah, so it's almost impossible to describe how many people and businesses have come forward to help in this. I mean, quite literally, I'm trying to make a list right now, and I have over 100 people, businesses that have contributed either meals to the hospital, fabric, masks, you name it, and people have donated. N95s, people have made face shields, and I don't mean like 5 or 10, I mean like 200 face shields. It's absolutely insane the way this community has come together. We've had businesses donate fabric that is being used and certified in other countries to make protective equipment. And that's kind of allowed us to use our volunteers and some local businesses that would have otherwise been closed down to make some of these as well, which is really cool and at least give some people some sense of normalcy and again that control factor that not you do have some kind of control in what's going on. But really, it's been pretty impressive the way organizations have come together and worked together. And like I said, it's really hard for me to even name all of them because I alone have a list of over 100 businesses and people. And I know that's just the hospital. And there's definitely other clinics, other emergency operations centers that have also received this kind of support so that everyone is being protected and
Hmm.
getting the help they need.
Um, how many people are at the hospital? Work at the hospital? Have you?
Well,
Do you know if they've had to scale back any?
so there has been some like low censusing or have some scale back essentially just because trying to reduce the spread and because for the long I mean for a month people weren't getting their regular primary care. So
Mhm.
just as far as regular operations, things were getting stalled out. Surgeries were getting stalled out. And so a lot of the things that keep most of the people here employed, which there's around 600 employees at Delta Hospital. Yeah, we're the largest employer in Delta County. Um, and so a lot of those haven't been affected, that front line, most of the nursing staff, physicians, those kind of things. But anybody who works behind the scenes, those ones it's been a lot more of a struggle and adaptation because what they usually do, which is extremely important, isn't necessarily happening on their side.
Mhm.
Um, so the foundation does have funds set aside for like a employee emergency fund is what we call it, so that as people are getting low census, working less hours, and who knows, like their partner could have been laid off during this time as well, we're able to kind of step in and help with essentials, but utilities, groceries, things to make sure that they know they're not alone in this and that we're all together, and that's much better. We work better that way.
Mm-hmm. That's great. I'm not sure if you can speak to this, but I know that there is, in addition to being really pretty rural, Delta County, you have a lot of, don't you have a lot of migrant workers there?
We
Have you,
have,
is that an issue that's being impacted, or if you can even speak to that, it's up to you.
I can speak a little bit to it. I don't have a lot of in-depth knowledge. We don't have actually near the immigrant population as some parts, especially rural parts of Colorado. But it's still an issue, and both on the front of protecting these populations and going forward, how a lot of our immigrant population is our harvesting population. We're huge in grapes and orchards, and we don't know quite how that's going to play out, both in protecting their safety. I mean, do you wear masks when you're walking down orchards picking apples and pears? Probably not peaches this year, it doesn't look like, but some of the other things. And are they even going to be allowed to? Are we going to be able to get that population here to get to the things we need done? And how are we keeping everyone safe while doing it?
Mm-hmm. How do you think the communities, I don't know if you have a finger, an idea about this, but I know initially there was quite a bit of fear, and now we are in the second phase, right? The safer at home, not safe at home. Still our governor is recommending social distancing, but as of today, May 1st, our federal government is not any longer. How are the citizens of Delta County, how are they feeling? How are they responding? I mean, when you go to the grocery store or the hardware store, what are you seeing?
You know, it's kind of a hard thing to put your finger on at this point, because we're still you're still social distancing. You're still not going out and really getting in your groups of friends and family and meeting with everyone. So you end up just seeing things face value, like walking next to people in the grocery store. And to me, that doesn't give a very good picture of how people actually feel about what's going on. Right now, it's 50-50 when you walk into a store if everyone in there is wearing a mask, or you walk in at a different time and no one's wearing masks. Like, it's kind of interesting to see that it isn't very uniform, I guess. And probably the best and worst way for me to even look at how people feel in the community is via social media, which is horrible because people see social media and they share memes or this or that, and they're always extreme views of whatever they might kind of be thinking. And so I think it really gives a bad example of what people are actually doing. Someone can sit behind a screen and say, everyone wearing masks is ridiculous and horrible and makes no sense. But when they go out in public, they may be keeping more than 6 feet distance from people because they're not wearing a mask. And they may be actually taking actions that are much more safe and compassionate than what they're typing. So it's kind of hard to judge where people are actually at.
Yeah. Has the hospital done any, and I don't know if maybe you're too rural, has the hospital done any telehealth?
We've actually done a lot of telehealth. They made that transition pretty quickly, actually, once the federal government kind of changed their regulations as far as what they would allow people to do. And our clinics jumped on that really quickly. We have a lot of elderly population. Like, that's a big chunk of our groups. And so there's a lot that they need. They need regular contact with their physician because we have higher chronic care, higher issues with chronic care.
Mm-hmm.
And so they went to telehealth, and everyone was pretty hesitant about it. But it's actually been really interesting to see the amount of phone calls more than the traditional, like what we're doing, telehealth, That's probably a little bit less just because people aren't always comfortable on their computer or they don't have the broadband for it a lot of times still here.
Mhm.
Um, but we've been able to use phones still a lot to keep some of that care going.
That's awesome. And it's nice to be paid for that now.
Yeah, it helps keep some money coming in the door when everything else is stopped.
What have you learned about yourself during this time? Or what has surprised you most?
Um, I'm generally not a super emotional person. And when this first started and I was on the phone literally for 9 hours to 10 hours of a day with people asking me questions of how they could help. And we were getting donations of a couple $1,000s from local businesses so that we could help in other ways. And I just started crying. I was like, I couldn't believe people were that willing to help and wanting to help. And it was so like they weren't gaining anything from it. They just wanted to send something to the hospital to protect the staff. And it was silly. I was like, oh my God, I'm so stressed because I'm crying and this is ridiculous.
um, what's been the most difficult adjustment to your personal home life?
Um, I don't know, honestly, because I live in the country, so and I have this time of year, there's gardening and spring, and so I spend a lot of time at home by myself anyways this time of year. So that part's a little bit not so different. But probably reducing my friends and family engagement. I have nieces and nephews that are 5, 3, and 2, or 5, 3, and 1. And working in a hospital, like even as much hand hygiene and masks, I still come in and out of the hospital a lot. So I'm always a lot more hesitant to go be near them until I have completely washed and changed. And even then you're like, oh, I need to not be so close. So that's been kind of hard to adjust to. I've been fortunate that my partner is an essential worker. Everyone hears that term now, and I think we all kind of cringe a little as we hear essential. But
Mm-hmm.
uh, so he's still been working a lot, which so both of our schedules haven't really changed. We're fortunate in that, but it also means we haven't seen as much of an impact personally.
Are you from a rural area? Are you from?
Yes, yeah. I'm originally from actually southwest Colorado, like Durango, Ignacio area, and
Uh,
then graduated from high school in Hotchkiss. So completely rural.
yeah, I guess so. Um, well, I don't know if I even like this question. How do you think this event will be remembered in your community?
I think it'll be remembered as a time that every part of our community came together for one cause. We have really unique communities with their own little personalities. And in such a small area with such a small population, you wouldn't expect such extreme differences in such a close area. Um, but we have it, and this is one of those instances where it doesn't matter what community you're from. We have groups volunteering and helping from all of them. So I think and hope that that's kind of how it's remembered, is that everyone was looking out for each other. And I guess I should say that, like, part of why everyone going the extra mile and in supporting each other is so interesting and so impressive here is because we're not an economically advantaged community either.
Mhm.
Uh, People here going to be hit hard by this economically. I
That's
mean,
exactly what I wanted to talk to you about. Is that poor people, right, who can't pay their rent, still owe their rent, and as of today, right, I think our people can begin to be, eviction processes can move forward, and so imagine being low income and owing money and having a judgment against you and trying to get out of your place and find a new place, is there's really not that much housing available to begin with. How are people going? I mean, this is going to, I imagine that this might be in for a long haul for some people, recovering financially from the fallout of this. And then that combined with, I don't know about you, but I've heard, foundations and fundraisers. Springtime is the start of all of that, right? How do you move forward? You know that this need is going to be out there in your community. It's going to last a long time, and now your hands are tied with you can't get out there and fundraise like you normally would. Can you speak to any of that?
So that's a lot.
And that's probably why I didn't. It's a hard time getting it out.
I know. It is going to be a long recovery. People who are impacted financially are going to be impacted hard, and it's going to be the people who couldn't afford to do so probably the most. And that's how our community is going to come around that in the future is going to be another interesting thing to watch. I think the other side of that is that a lot of nonprofits around here especially rely pretty heavily on local businesses to make donations for us to then do the good that we need to. And so many of our local businesses haven't been operating. So those donations are much more in question, and we know the need of the people is rising. And so trying to solve that and make those together, it's a moving target. Hopefully because we're so rural and we don't have quite as many luxury businesses, I guess you could say. A lot of our businesses survive because they're quite literally essential. Mm-hmm. We don't have quite as many of the unessential things. So hopefully that helps a little bit minimize the impact. But it's still going to be a really hard thing to recover from. And I think that's a question not only for here rural, but across the nation. Like how are we going to come together to help the people who are impacted by this, that are definitely being hit the hardest with the least support available? I don't have a good answer for it, unfortunately.
Thank you. Is there anything else you want to talk about? Any props you want to give to anybody? Any, I don't know, just any last words of wisdom?
Words of wisdom. Prepare for what you think will never happen. I mean, I don't know if that's really helpful. No, I think just giving props to our community for being so supportive especially from the beginning when we didn't have a lot of cases here. Like we didn't have our first case until the middle of March, maybe at the earliest. But I had probably 1,000 masks in my hand before that even happened. There were people who right at the gate were just over willing to help. And so just to say thank you to our community that's just gone above and beyond and allowed us to be able to operate now. Once cases start building, we already have all of those supplies and we're able to kind of react a little bit more appropriately. So yeah, just an amazing community would really be the top of my list.
I love it. That's great. All right, Kaitlyn, thanks again.
Absolutely. Thank you. Have a good one.
You too. Bye.